Week in America and the Blue Funk Broadcasting Radio Network. As mentioned in the beginning, back with us on the program, Dr. Rudy Cashman, Medical Director of Cashman Mind Body Institute. Doctor, a pleasure to have you back on the program.
Oh, Rick, it's my pleasure to be here again.
Well, there's so many interesting things to talk about, and Dr. Cashman has written a number of just fascinating medical books, got CDs and DVDs as well. You can get all the information at our website and then link on to his. But a new book called Nocebo, the Evil Twin. Now, let's first of all, we all think we understand the word placebo, but explain placebo and nocebo, because this is fascinating, and all of us, when you're talking about this, can start relating to what you're saying.
You're right. We need to start with the definition here. Placebo, that's been around for thousands of years, and that means I will please or I will heal. And what can a placebo be? It can be a pill. As long as I hand you a pill and you believe that this may help you, it's got about a 70% chance of working because of the neurochemistry of your brain. Belief. You believe it. A placebo can be a medical provider. Believe me, in my 41 years of doing this, Rick, at age 39, that if you have faith in the doctor and you realize the doctor cares about you and loves you, he has tremendous healing power because there is, as Dr. Herb Benson from Harvard would say, there's a doctor living within us that knows how to heal us. Our body remembers what it's like to be well. So it can be stimulated by a pill. It can be stimulated by a loving doctor. It can also be stimulated occasionally by an accidental operation. You don't know for certain what the problem is, and I explore this nerve because the patient's getting worse, terrible leg pain like I had an executive recently, and I finally explored it. Maybe he had a hidden disc. I found nothing. And I just took a lot of arthritis off of there, and I had to be a healer that day because the gentleman ran a factory of 35 employees. He's going to fire them all on Monday if he didn't get better. So I went out and I said, "What did you find, doctor?" I said, "Well, the nerve was swollen, had a little arthritis present." Rick, I didn't find a thing. And you know what? He's at work on Monday, and 35 people had a job.
Found something,
he thought. I didn't lie. I was a healer that day. Now, what's the nocebo? That's a negative talk. There are probably 10,000 books at least published on the placebo. You know how many books are published on the nocebo? I think I'm the only book there is, I think. A few articles, maybe. Google it and find out. Very few.
Yeah, I never heard the term before.
Yeah. I've asked 350 doctors who knew what the term was. They do not. And that means I will harm. And it's used in medicine all the time. And it saddens me that providers don't know the term. Let me give an example of a nocebo effect. I saw a patient recently, had low back pain, and her doctor, nothing helped. The doctor did an MRI scan. It shows degenerative disc disease, arthritis, consistent with her age. She's a bit overweight, and you expect to see that. He said, "You need a back fusion." Hands her the X-ray report showing this degenerative disc disease was totally consistent, just with her age, just with her size. It really didn't mean anything. She comes in to see me, and she wants a back operation. And I said, "Mrs. Jones, what's going on in your life?" "Well, she lost her job 3 months ago. Her mother died 2 weeks ago. So I thought she had fibromyalgia." But she believed that she needed a back operation, which she didn't. She got noceboed by her provider. I see it a great deal in back surgery, where they go see their doctor, get a back pain, and maybe the reality is just stress and fibromyalgia and tension, and the surgeon either doesn't know better, maybe he does know better, I don't know. He says, you need a back operation, and they show him the MRI, shows the process of aging, and he goes to the operating room when that MRI may have had nothing to do with the problem. So this nocebo talk, this negative talk, is used a great deal in modern technology and in blood tests and in CTs, MRIs, even angiograms. I saw a heart patient recently. The same lady I'm talking about with the low back pain, the fibromyalgia.
Right.
She had a scar down her chest, and I asked her about that. She had normal, every study was normal, triglycerides, everything was normal except the angiogram showed a little change, which at age 45, and if you're overweight and diabetic, you expect that. And she was having what I thought was atypical chest pain, a stress thing. And they operated on her heart. So she was noceboed by her provider in the angiogram. Can you see, Rick, how important to know about the nocebo really is?
Well, and you talk in your book that basically a doctor, by using the wrong words and planting this nocebo in their mind, that can lead to illness and can even lead to death.
Yes. Let me give an example of that. My son being a neurosurgeon, and he said, "You know, Dad, I know exactly what you're talking about now." And it's very interesting. He had a patient with a small brain tumor, and it looked malignant on the scan. You can't, on the MRI, you can't be 100% certain. You know what I mean?
Right.
But he goes talk to her. Well, doctor, you know, she had 4 kids, no husband. And she says, doctor, what do you think it is? Well, it looks malignant to me. What does that mean, doctor? Well, if this proves out, how long I get to live? I have 4 children. I have no husband, no family. And he said, well, you know, usually about 6 months. She started screaming. She never did stop screaming. She screamed all night. And then usual reaction, but do you blame her? I don't blame her.
No,
Had 4 kids, no relatives.
No.
Wouldn't you scream? I'd
Yes.
scream.
Yes.
And so the next day does a biopsy. Confirms the malignancy, goes back, talks again, uses the same words. She screamed worse. By the next day, Rick, she was dead. How does that happen? It's like voodoo effect. It's belief. It's belief that causes secretion of adrenaline in the blood, and you get fibrillary degeneration of the heart, and you die. It's like the witch doctor pointing a finger at you.
Right.
And if you believe that the village has decided you should die, and that finger pointing at you, you've been picked out, you indeed die. That's in history.
So basically scared to death.
It's scared to death. This is a true thing. It happens. So you can see how important that word is in medicine. Yet I've never met a med student ever knew what the word meant. I personally have not met a doctor who knew what it meant. It's kind of sad to me because it's a huge thing.
You're listening to This Week in America on the Blue Funk Broadcasting Radio Network. Dr. Rudy Cashman is our guest on the program, medical director of the Cashman Mind Body Institute. His website, Cashman Mind Body Institute, or mindbody.com. You can go to our website, thisweekinamerica.us, and link on to the doctor's website. And Cashman is Kachmann. Fascinating book. The book is called Nocebo, the Evil Twin. And I want to go back. We defined placebo and nocebo. Mm-hmm. You talk about illness and disease, and I never really thought about that before, but there is a distinction. Illness and disease. Explain the distinction between the two.
And that's a good question. You got to admit, Rick, that's a pretty catchy title.
Oh, I love that. Yes, it had my interest right away.
Yeah, the difference between disease and a disease is something that you actually have, like diabetes. But an illness is medical symptoms that you have that are based on your own belief. So an illness is your own belief. I even own and copyrighted a body-mind index. These are 20, they can be seen on my website. These are about 20 illnesses that are due to the perception of the patient. Diseases that like fibromyalgia, irritable bowel, tension myositis, atypical chest pain, irritable bowel. These are illnesses that manifest in the body but are due to the neurochemistry of your belief. And if you can run studies all day and you find nothing. You find nothing. So that's an illness. Illness is your own perception. A disease is something I demonstrate on a lab test or an X-ray CT.
Right. Now we think when we have symptoms, and I want to talk in a second about the patient expectations, because we're at fault here sometimes too, thinking we go to you, you're going to either operate or give us medication and we're going to be fine. What you would like to do, and you say in I think 70% of the cases, if I do this right as a wellness coach, I can take care of you without invasive surgery or without giving you medication. But let's talk a little bit about with illness, sometimes we want to make it into a disease, don't we? And if you as a medical provider don't use the right words, it does lead to disease.
Absolutely. You can easily mislead about 75% of the people. 75% of the people see a doctor in general have a physical presentation of stress. Now, if the doctor does not identify it as such and starts running tests, and the patient is in a hurry, he wants a quick fix.
Right.
And he starts running CTs and MRIs, and he made angiograms, and may demonstrate the process of aging. He can try to relate that, the nocebo, to your symptoms before you know it. Your gallbladder jumps out, your uterus comes out, your maybe unnecessary disc jumps out, and occasionally even have a heart operation because you were noceboed by those tests and your perception. So what should doctors be? The medical school has to stress to graduate wellness doctors. We don't need the brightest people in the world. We need loving doctors taught in wellness. But I'm afraid we graduate a lot today, and I'm serious, and I hope some of you medical school are listening. We're graduating engineers and carpenters of the human body, and I am totally serious about that because I went to the medical school at IU and I presented You know, I asked these 3 med students that were standing up in an alumni meeting if they had been taught wellness or proper nutrition in the med school, and one of the girls, and they even had a little conference, and when one of the girls finally said, well, a little bit in my sophomore year, when 75% of the people that we see need a coach. It's all they need. They don't need big tests, big MRIs, big procedures. Same thing at IU Purdue recently. I gave a talk there to the sophomore class. And I was giving a mind-body lecture, and there was this a pretty girl, daughter of a doctor that I knew, and I asked her to stand up, and I said, of the patients you'll be seeing next year in the clinic, she'll be seeing patients, what % do you think will have a physical presentation of stress? And this girl was terrified about the question. I could read it in her eyes. She probably was a straight A student, had never missed a question, and she was terrified by the question. And 6 of her professors were sitting there, and she thought about it, and then all of a sudden she puts up 0. 0. And here we are, a sophomore medical school, and we do not know that our head is attached to our body. Descartes in 1635 cut the head of the body, and he gave it the head to the church and the body to medical profession, and we still practice that way. It's been changed very little. Unfortunately, we could save billions, and I don't mean millions, Rick, billions of dollars if we were more thoughtful in how we practice medicine.
Time goes by so quickly. Let's go back to, from a patient standpoint, how do I prevent become a nocebo victim? What relationship do I have with the doctor so he is not planting these suggestions that I'm probably sicker than I actually am?
I think you're going to have to educate yourself a little bit. I think looking at our website would be a good thing. On my website, I have a book called Welcome to Your Mind Body. That's the effects of your mind on your body. Great book to read, over 200 pages. I have the Mind Body Index there, listing illnesses caused by the mind, so that you have some understanding of it. Otherwise, you will be misled. Unfortunately, I read a statistic recently, and we need to change that 60 to 70% of the people who see a physician have no interest in participating in their health care. Whatever he says, they will do. That's a sad statistic, Rick. Where do you think it's going to lead? A lot of the time. It's going to lead to tests you don't need. It's going to lead to an operation or an injection you don't need. I see this especially in pain centers, especially in that area. Too many injections, too many narcotics. Narcotic addiction starts that way. They will relate your pain to the MRI, do the nocebo, and use that as an excuse to stick a needle in your back. And afterwards, that's the entrance to the circus. And then they give you a narcotic. And then you become addicted. And then, of course, you come back because you need to feed the addiction. I don't blame the patient here.
Well, you talk in the book, and the book is called Nocebo, the Evil Twin. I got just a couple minutes left in the program, but you talk about every day seeing people in their 80s come into you that are taking 10, maybe even 20 pills a day, yet they're overweight, bad diet, and the implication being, if you would listen to me and I could straighten up a few of these things, you lose a little weight, you have a better diet, you can get rid of some of those pills and enjoy life a lot more.
Absolutely right, Rick. I see people in the 80s on methadone for a little old backache, when in reality, they should have been taught, strengthen their muscles, stretch more, exercise more, maybe get a personal trainer. At my Mind Body Institute, we have trainers, group training. We try to give very cheap Zumba dancing. Now we're starting ballroom dancing. I may take the class myself, and to make it fun, and to try wellness programs. And then the public's aware of that. They know this taking 10 pills and you're in your 80s and you're on methadone is nothing but ridiculousness. But it's, I hate to admit it, Rick, it's, the fault of the guys writing the prescription. We physicians need to be wellness people at all levels, including specialists. You see, we have organ doctors today, heart doctor, kidney doctor, back doctor. We need holistic doctors. Every physician in every specialty must know wellness, including dermatology. A good third of the skin diseases are caused by the human mind, stress.
Well, and we've talked about this before. You feel stress is a national plague. It really is taking quality out of our life and years off of our life.
Absolutely. Stress is a national plague, and we must learn to identify it, learn what to do about it. It's probably in some ways not avoidable because our lives are so complex. Threat of job loss. I see people every day who've lost their job. How can you live when you get a mortgage to pay? You get kids. In fact, I don't know how some of the patients that I see sleep at night. I do not know. I mean, I have one in the hospital right now. The wife isn't working because she has to watch the kids, and he's in there disabled from a chronic back problem. How do they live, Rick? Get a Social Security check. How do you live with 3 children and 2 adults in the Social Security check? I don't understand it.
Got about 30 seconds left. When we're talking to our medical provider and they're recommending medication or they're recommending surgery, should we say as medical consumers and taking control of our own health, should we ask, is this necessary?
Absolutely. But then again, you have to question the provider. Does he know what is necessary? And I see a great deal of narcotics given for what I call metabolic pain, based on stress, anger, or depression, and it's got nothing to do with their spine or some other part of their body. Don't accept narcotics unless something is broken or you have cancer or something very obvious, you know, gallstone, kidney stone, or something very clear. But just don't accept strong medication unless it's very clear, know the cost, so you don't waste money.
Another fascinating discussion. Dr. Rudy Cashman has been our guest, medical director of the Cashman Mind-Body Institute. The book is called Nocebo, the Evil Twin, necessary reading for all consumers of medical care all across the country. Our website is thisweekinamerica.us. All the information on Dr. Cashman and getting the book available at our website. You're listening to This Week in America on the Blue Funk Broadcasting Radio Network.